Hello, welcome to the BariNation podcast, where we support the bariatric community with humor, humility, and honesty. I am Natalie. I'm not joined by April and Jason today. We're doing something a little bit different, but I think that you guys are going to like it. So today and this month, we're talking all about pre-op love and what we wish we knew before surgery. Today, I'm joined by three pre-op folks who are in our BariNation community. I've gotten to know each one of them pretty well, and I'm just excited to talk to all of them today. So I think we'll have everyone just start introducing themselves. Lisa, would you mind going first?
Yeah, so my name's Lisa. Obviously, I'm pre-op, and I've been kind of in this process for a little over a year now. I think, a little over a year since I first saw who will be my surgeon. So, yeah.
It's a long road sometimes.
Yes, it is. Yes, it is. You think it's going to be, next steps and go forward. And then you're like, oh, no, okay.
Absolutely. It's not linear. We'll get into that for sure. I'm excited to talk about it. Miss Helina, you can go next.
Hi, I'm Helina. So I got referred in February of last year, but between different things, life happened. I didn't get to start my journey till July. So now I'm at the end and I got approved. I found out yesterday I got approved for surgery. But hopefully I find out a surgery date next week. And I'm going to post on my Instagram that I got approved because my letter's supposed to come in today, but I'm like, I'll just say it on the podcast.
Oh, that's so exciting.
That's super exciting.
Awesome.
Wow. Congratulations, Helena.
Thanks.
That's so great. I know we'll get into it more, but you definitely have had some bumps along the way, and I'm just proud of you for continuing on.
Thanks.
Yeah. And Miss Ashley.
Hi, my name is Ashley. I live in New York. I am pre-op, and I have my date, which is going to be on April 5th. I'm having VSG.
Awesome. So exciting. Man, well, I think this is going to be a great conversation. Today, we are basically focusing on what these ladies wish they would have known prior to getting on the bariatric bandwagon, starting that journey. And I say we just dive in. Are you guys ready?
Yeah.
Yeah, let's
Ready.
do it.
All right. So I think I'm just going to have us just roundtable April style and give, a couple things that we wish we would have known. Let's say 1 to 2, I guess. So Lisa, would you like to go first?
Yeah, sure. I think one of the biggest things that was like a huge realization for me was this idea around obesity being a disease and not just this thing that, I don't know, was the result of being lazy or genetics or however people define it, and then, but also on top of that was that your body like scientifically wants to hold on to the weight that it has. Mm-hmm. And I don't remember the percentages because my surgeon did a whole presentation on it, and it's been a while now, so I don't remember the exact numbers, but the likelihood of being able to lose large amounts of weight and keep it off, the percentage is like very low. Mm-hmm. And so I wish I had known that sooner, mm-hmm. so that I could have made a more informed decision early on. Or much earlier in my life, rather. And that conversations with doctors, especially primaries, because that's who we see the most often, that they were more informed and could have conversations that were more productive than just, hey, you need to lose weight. You're overweight. This isn't healthy. Whatever that may look like. Because it's just not approached in that way. And it's not helpful. You don't leave feeling good. And so you just kind of push it to the side. So we could have better conversations around it that weren't a blame game, be a lot better.
Yeah, it's always interesting to look back when you start to dive into what bariatric surgery is or what obesity is, and you think, man, like this whole time I just thought I was, and I say this very lightly, I just thought I was fat and lazy. Like I totally agree with you, Lisa. Ashley, have you felt that way too in the past?
Oh, I think I definitely have. I definitely agree with you, Lisa, that I mean, I think you had primaries who at least brought up your weight. Mine, I'd be like, we're not going to talk about it. Like, or I would bring it up and it would be like, oh, you should just meal plan more, eat less processed foods. And I was like, okay, yeah, try those things. And then I don't think that I had that like validating conversation until I went in for my first appointment. And I didn't say it before, but I was thinking August 1st was my 2022 was my first appointment. And then like coming onto the BariNation community, like, and we're just learning more in my own like learning piece to really kind of understand that, like, oh, there's other people who are feeling or experiencing the exact same things. And it's just not talked about like really outside of the bariatric community. Like I'm not finding that to be a discussion at all. And so it's been fascinating. It's been a fascinating adventure.
Definitely. What about you, Helina?
I agree with all of it. I agree with all of it. When I had brought it up to my surgeon that I wanted surgery, because a lot of it before was, I think what Ashley said, is just diet and exercise, the normal stuff. So when I said it, she was like, oh, okay, yeah. And I was worried about getting approved and all this stuff. She's like, nope, you're fine. You're fine. You're fine. Let's do this. Like she was one like gearing me up to do it. And my PCP's always been really cool. So it was an easy conversation to have with her. It's just weird how much I didn't know till researching in BariNation. So, and I'll say more when I'm on my turn as well. But, yeah.
Well, and I think it's fascinating just how open she was for that to be a step for you, but it wasn't necessarily a conversation that she had with you, right? Because I mean, obviously it's super awkward, right? Like I've had awkward conversations with my doctor where they're like, hey, I don't want to be like a jerk. I don't want to like, I've had good doctors, but at the same time, I almost feel like in some ways, like some PCPs maybe don't have all of the knowledge, and maybe that's not in your case, but also just that ability to have that conversation, which is frank, but also kind and also informative.
Agreed.
Yeah, definitely. Helina, what about you? What do you wish you knew?
I wrote them down because I watched the podcast as soon as I saw it on Instagram. I'm like, oh, I need to see this, not knowing it didn't click till a few minutes in. Oh, this is why I'm on the podcast this week. So, I mean, I make the joke kind of all the time that like, oh, hey, what? I'm not gonna get this surgery and die on the operating table. Like I've always had that fear in my head. And then I think you guys had said it too. You have more of a higher chance of dying from obesity or like complications from being obese or side effects, something like that, than actually getting the surgery or one of the surgeries. So that was mind blowing for me. And that I think what Lisa had said, that is a disease. And then, oh man, that makes just like those things. And the mind work, the mindset that I have to really, that I'm still going to be working on, but like how much this messes with your mind, how much, I know personally from being obese for as long as I can remember, a lot of trauma has to do with it for me, and why I've eaten the way I have for a long time too. It's coping mechanism, it's my best friend, all the above. And so having to undo and like retrain the mind that, oh no, wait, what, this isn't healthy. I've been doing this for 25 plus years. This isn't healthy. What? Oh, there's people out there just like me who've gone through the same things, think the same things that I do. Hallelujah. First off, so like, I'm not alone. You feel so alone for so long. Like it's nice not to feel alone anymore, that I have my people. You guys get it.
That we do.
Mhm.
You do get it. And I think Laura Grabo said it, our head bariatric therapist here at BariNation. We love her.
Yeah.
But mindset really is the missing piece that we don't, similar to what Lisa brought up earlier, we just don't have those conversations. That this is hard mind work, just as it is hard work to lose the weight. Helina, what are what's one thing that has been pretty major for you mindset wise that you've had to shift?
I'm a negative Nancy. So, and like, I am one of those people that when you give me a compliment, oh, there's so many memes for it too, but I'm like, oh no, I don't know what you're talking about. One of our dear, amazing ladies in the community, Cheryl, she had brought me one of the paintings that I got from her that I just love it. She's like, oh, you're looking good, girl. I'm like, she's pulling up my shirt, like, I don't know what you're talking about. I haven't lost weight. And she's like, no, you look good. And I didn't know what to do. So it's just untraining all these things, like, and not feeling deserving of a lot of good things in my life that have come with this process of getting the surgery, finding this community, this whole big weight loss surgery community, that I'm deserving and worthy of all the amazing things in life that I've wanted, but I said, no, I don't deserve that for so long. So really doing that and flipping the negative to positive around. Oh my gosh, I could count on many fingers how much I like speak so badly about myself. And it's sad. It's sad, but I'm trying. I'm getting there. I'm in therapy, and then I do when I can. Laura Grabo's classes have been fantastic, and just when I can, I try to hop on there, because just every time she says something comes out of her mouth and it just like whoosh, makes sense, and I'm like, oh, okay, so that's why I've done that for years too. Cool.
Yeah, she's kind of a wizard in that way.
For sure.
Yeah, I understand that. We talk to ourselves in such horrible ways, and then it's like one time one of my friends like checked me on it, and she's like, you would never tell me that. I was like, no, you're right, I wouldn't. And then she's like, why are you telling yourself that? And that in itself was huge. And the rest will come. It's like one door opens, then they all flood open.
Right.
They all
That's what it feels like.
connected.
Was that Pandora's box or what?
Exactly.
Oh.
Ashley, what about you? What's something mindset wise that you've had to shift?
I think through BariNation, not necessarily through the groups and stuff, through my like surgery center, like pieces, but thinking about the like emotional eating, because I know there's a connection, but I don't always didn't think about it, like, because I think there's like a few, from what I've seen, sort of in the bariatric community in general, the idea of like some people are emotional eaters, some are just more like they're just addicted and like to the food piece. And I was like, I don't really think I'm an emotional eater. I remember saying that in my like the couple psych appointments that I have early on, and but doing the classes and being in the groups with like Laura, I think hearing her talk more about it, and other people who kind of like know I am an emotional eater, and hearing what their experiences are, is like, oh, okay, wait. So then I've been like more attuned, I guess, to like that. I've been more aware. I said that to somebody recently, and they said, so have you had like that shift yet? And I said, no, but I think the big shift is that like I'm aware that I am more so than I thought I was. And Laura recently did, I think it was like a week or so ago, did that like master class kind of on emotional eating. And that idea of like, it doesn't last very long, 3 minutes or whatever she said. Had a rough day the other day. I was like, also because I didn't eat consistently throughout the day, I was super hungry and I was so tired. I think I was emotionally tired. And then I was like, oh, I got a chance to eat real quick. And that like feeling, that tired feeling went away for just a few minutes. And I was like, oh, like I feel it and I've connected it. And that was something that I don't think I would have put those pieces together in that way um on my own, or without the help of like that mindset work, because I think I've really been aware the last, I'd say like couple months of thinking about it, and I needed to almost do it to say like, oh, I feel it. And that's what that feeling is, and being able to check it or change it moving forward.
Yeah, for sure. And I talked to Laura again later, and I said, wow, so it lasts 3 minutes. And she's like, she corrected me, she said up to. So sometimes it doesn't even last the full 3 minutes.
Mm.
And
I felt it. It was not long.
Wow. Yeah. It blows my mind too. And I'm 2.5 years post-op, right? Like there are things that I've learned about emotional eating where I was like, oh yes, this is why I want potato chips. And then I feel sick after, X amount of them. But yeah, I'm glad that you were able to learn about it, and then you it's almost like you put it into practice, right? So that you could see it and feel it and understand it more, which is awesome. Lisa, what about you? What's a mindset shift you've had to go through?
I think the biggest thing was kind of dealing with like automatic thoughts or responses, the ones that you don't even process. Not mean like you can't even like pinpoint them or acknowledge them in the moment. So I've been doing therapy for a couple of years now, and one of the things that we've kind of talked about is slowing things down, about kind of taking that beat and kind of looking at, maybe not going and doing the thing that, you're having an automatic response to, whether that's food related or anything else, and just taking a moment to stop. And you still might do it, right? But it's about slowing it down, because, like Ashley said, acknowledging it is and being able to identify it is kind of the first step. It's not like, oh, well, now I'm aware, so now I'm not going to do it. It's like, that's not how any of it works, right? So just that kind of slowing things down and taking that moment. And, I mean, there's that classic thing of like, the first step is acknowledging the fact that you have a problem. So I think that's kind of one of my biggest things. Yeah, that's the one that comes to mind right now.
It's the awareness and being able to acknowledge it. Like you said, even if you didn't not to go through with whatever the thing was, you still went through with it, but you were able to see that it was happening. That's something that I never had pre-op. I was like, I am mad that all I can eat is X amount of calories, but I'm gonna do it because I need to. And like, I didn't understand why I was reaching for sugar-free popsicles like they were like, I don't know, candy or something. Like, I went through so many sugar-free popsicles, you guys, but it never made sense. And the fact that you guys have the awareness now is huge and so exciting, because you get to bring that into your post-op life too. So I just wanted to give you guys props, because and then I got slammed in the face. But for sure, the mindset part is a lot of work, and you guys are doing it even without the tool in hand. So that's huge.
And that's one of the things that I'm most curious about is what it's going to be like post-op with that, like, because I don't know what that world looks like, right?
Mhm.
Like, all I have to compare it to is the copious amounts of diets that I've done throughout my life,
Right.
and the mindset there, and how it doesn't last, or it's not sustainable, or, you know, so many things. So that is kind of one of my things I'm most excited about, but also the most scared about, because like my track record, quote unquote, doesn't support it.
Yeah.
So
Yeah.
yeah, that mindset will be very interesting.
You have no evidence.
None.
You don't have that security in knowing that it's going to work, which is understandable. But also, every single one on this screen, everyone listening who made the decision to have this surgery made kind of I don't want to say an uninformed decision, but you don't have the evidence to back up your decision. You're taking a risk, which is going to pay off. We know that it's going to pay off, but it is unknown and it is scary.
And I think one of the things for me is like, I'm the variable, right? Everyone who's had success, they were the variable. The surgery, the process, the tool that exists, but you as a person are the variable. And that's, no one can tell you that, and you can't even tell yourself because you've never been in that situation with the tool. So yeah, it's very fascinating, and I'm very curious and excited, and also, like I said, worried.
The unknown.
Yes,
That is
always a fun thing.
Yeah, I am so with you on that. The unknown is what's freaking me out. It's like I'm so excited to finally get the surgery, but then it's like, oh wait, you don't know what's gonna happen. You hope you wake up, all that jazz and all that's like positive thoughts, but the unknown.
I think, you know, like the first question you asked was like, what do you wish you had known? I think that I go to the appointments, and I think we kind of just said that, like, you feel validated, right? You start kind of the education piece, but I don't think if I hadn't researched on my own, that I would have maybe just stopped where you said, Helena, like I've just stuff like, oh, I woke up, that's great. And then kind of thought like all the appointments and everything I had to put in, like I think I counted like the other day, like 20 appointments between August 1st and like today. And that doesn't include like a couple more that I have between now and my actual surgery. Like I thought that was like the work that I kind of needed to put in, and I'll just eat less. And then just, you know, you hope you wake up and you're like, that's the end of the thinking about it. I think that's, well, I know that that's not true now. But I think that's kind of maybe what I don't know, maybe that would have scared me off if I had known that more when I first started. But like, I'm happy to know that now, but I didn't know that initially. And I think, yeah, I just really thought it was like all the stuff I had to do before, because I was like, check this box, check this box, check this box.
Yeah.
I'm like, all right, that's cool. Let me get it all done and like hurry up and wait. And then I'm like, wait a minute, I'm learning. There's all of this the other side, you know, of the surgery piece. And it's not just once it's done, like it's all good and it's just as easy. Like you were saying, Lisa, like now, oh, we're good. But no, you are the variable in it, you know, and
yeah, I can't speak for anyone else. I thought that the surgery was the finish line. It's like, if I can just get to the surgery, I'll be in the clear. Like, I'm good. I won the race. But it's really the starting line. It's like you hit go the moment you wake up from surgery. Surgery's the easy.
It's the warm-up.
Yeah.
Surgery, you got a nice good nap and you wake up.
Hopefully good drugs.
Yes. That is my ask for the drugs. That's my tip. Right? But it's really the start. It's just the beginning. And it is scary. I think it does scare a lot of people off. People who listen to the podcast have messaged us being like, I had no idea, and have postponed their surgery because they're like, I don't want all of this yet. But at the same time, as you three are saying, it's really empowering to be able to go into something like this with the knowledge that you have.
Yeah,
sure.
I think that for me, like, kind of going into it, I knew that surgery was like, in some ways, like the first step, the start. Obviously there's pre-step. And I think that's what was always kind of daunting for me. Because again, going back to that whole variable piece, like, what if I do this and like all this hard work, can I do that for that long? Like for the rest of my life? And again, it goes back to, there's no proof. Like I have no proof in my past that says that I can't.
I think I check that thought now lately by thinking like, I'm doing hard work right now. It's hard for me right now. And that's why we're doing it, because I've really been thinking about that more of like, now I think now that I have my date, I've said this, I'm like on the like excited and then I'm anxious and then I'm excited and then I'm anxious. And it's like, just back and forth. But the anxiety time is like, oh man, I'm doing this forever. And now that I like really have a better idea about what I'm doing it forever. So I think we're fortunate in that way. Like you said, Nat, sorry for those who didn't have like all the support and like the information wasn't out there. But that is like heavy sometimes, like when it's not you're feeling your best day, that's heavy. And it's going to be probably that same way on the other side. But like, I feel so heavy right now, like, emotionally heavy, like in just the weight of everything that is a struggle right now, that like I've accepted that like a different kind of struggle is just, it can be better. So it's not the same, it's not the same hamster wheel, life is always going to like have something that's a struggle, but at least it's a different kind that we have to do, or something new that we're facing. I guess I'd rather face it like not also feeling like just tired and run down and all of the other things. Maybe frees up some space to be able to tackle the things that'll be hard on the other side.
Yeah. And I definitely think that it will. Like I I think post-op having, because you're going to see some sort of success, right? And being able to move through the world with a body that's changing and that is, for lack of a better way of saying it, weighing you down. I'm very excited for that, I have to say, because again, I don't know what that looks like.
Yeah. It's kind of like, someone described this to me once, and I thought it was very fitting. They said it was kind of like when you get brand new walking shoes or brand new running shoes, and your step does just feel a little bit lighter. You're still doing the hard work. You're still walking or running or whatever, but you have the tool now, which is our sleeve or whatever surgery you're having. And it feels just a little bit lighter. Like you can still do the work. It's still hard, but you just got that little extra bounce.
Freed up space.
Yeah.
Yeah. My dad has been asking me a lot, like, because he knows my confidence has always been pretty low. He's like, how you're going to feel so much better with your confidence after. And, I've gotten to the point now where I've been in a lot of pain in the last year, especially. And it's just like, it's more than just about like looks. I'm just done being in pain, guys. I just want to go on a walk without the plantar fasciitis flaring up in my left foot. I just want a pain-free life and to feel like I'm getting my life back, because the last few years it's just like done this, especially after my eye diagnosis. So I'm just ready to grab my life and take it by the hand and yank it back.
And you're doing that. So totally get that. Well, Ashley, last but not least, What are some things, I know you kind of mentioned one of them earlier, but what are some things that you wish you would have known?
Definitely that hurry up and check off all the boxes was probably not the way to go.
I did it too.
I think I did about 90% of my requirements in like a month, and I knew that I had 6 months to do to make that happen. I wish that I wish that I knew that the surgery, like, because I wish that I knew the surgery was for people who were like overweight or in the obese category, and it wasn't like, I know we always kind of say like, everyone gives the example of like the only experience you have with it is like my 600-pound life until you go looking for the community, and then you realize like, oh no, that's not true. So for me, I think I really questioned early on of like, should I be doing this? And kind of doing that comparison, like, and the idea of a comparison is a thief of joy. Like, just because my BMI isn't 10 points higher or whatever, like, I think I spent like a lot of time. I think I was really surprised that when I just kind of made the call, I was like, just wanted information about it, about the medical management. And then I was looking and I was like, oh my God, I flat out qualify. Like, and I have these other issues going on. Like, I could have probably done this earlier. I could have done this years ago. I just didn't know. So I think that's kind of maybe what I wish I knew more of. Like Lisa said initially, we're in Helena, that this was an option, earlier on, so you don't end up getting to the point where you're like, oh, I'm definitely making that phone call today, where you have to like really put yourself out there and make that phone call, or whatever, the email or however to get it started, because you're just feeling so everything, like, when your body is starting to really like break down and be very unhappy with you for carrying around the extra weight. I wish that, I guess that's, something else to say. I wish I had known that bariatric surgery is open to more than what you just see on TV.
Yeah. I will never forget my surgeon. I asked to talk to him on the phone before making the decision, not the office person, not the nurse. I said, no, I want to talk to him. And he said, even like, this surgery is really for everyone. Even those, like what you said, Ashley, even those who are, maybe just 1 point over and they're in that obese category, it really is for everyone. And when he said that, it clicked. And it's not just for people who are 600 pounds. It's not just for people who have like 1,000 comorbidities, or, it's like, you are obvious, like you are unhealthy. I was unhealthy. I was 400 pounds. Like, this is for me. And it goes back to the beginning when we were talking about, why is this not a conversation that people have?
It's my first conversation. The surgeon was like the second, well, a couple people deep into the first appointment I had. I met with him initially, and he was just like, this is a disease and this is for you. And, and just meeting with him several times, like over the last several months, when I saw him last month, he was just like, I think you're going to be really happy with the results that you're going to get out. Like, I think you're going to feel the way you want to be feeling. And because then I was hemming and hawing on which one do I do? And he's like, either is for you, either, option that you have available is for you. And just that really like validating perspective. And thankfully I've found some other providers along the way that have also been really open to like talking about weight and weight management. And that's been like really validating, I think, in this entire process. And they've been very supportive. And I just, I guess everything kind of came to me when it needed to come to me, all that information and support. But I just wish that that was out there for more people. So that way they didn't have to feel like they were alone. Like kind of circling back to the first thing we said, that you're the only one, those thoughts and feelings and behaviors.
Yeah, absolutely.
I definitely kind of want to second that, because it really isn't something, it's something that's been in the back of my mind, but I don't think I've really like dove into it, because it kind of makes me sad, because I feel like that is, I mean, I hate to say it this way, but like in my mind, 5 years ago, surgery was for other people. It was not for me. It felt like I was giving up, like I wasn't working hard enough. I had to fix me in not the right way, looking back, right? And so I really wish I had like, going back to the first things, been able to have those really good conversations with people that were informative and judge free and but also frank, because it was for other people. It wasn't for me. Like I could do it because I needed to prove that I wasn't lazy or, whatever, however you want to do it. But then going back to what I said too, but then to learn that the likelihood, the percentage of success rate on your own is so low. Like so low. Like I remember like jaw dropping low. I don't remember the numbers, and I don't want to say any numbers, because the ones that I'm thinking, because I don't want to be wrong and misinform anybody, but it's very low. And
It was single digits, right? Like
I'm pretty sure it's single digits. Like,
Yep.
and that to me was kind of the biggest eye-opening, explode, like mind blown, drop mic, whatever. Right? Because I was just like, I've been fighting this. Let me do math real quick. Like over 25 years of my life being up and down in different types of diets, trying to trying to reach a goal, trying to be healthy. It was never an aesthetic thing for me. It was just being comfortable and fitting into this world in a way that made me comfortable. And to like just not being able to have that information, like I don't know, it was a very eye-opening experience.
Yeah, it is. I guess to wrap us up a little bit, I would love to leave our listeners with maybe something that you can encourage them, like maybe something you want to tell anyone listening who is maybe thinking about having surgery, maybe starting their pre-op process. And I'll go around again, but I think it's important for us to be that voice for them, to give them what we wish we would have had. So, Lisa, what's something that you would tell someone starting their journey?
I would say if you haven't really made the decision to explore it, explore it. Get the referral, go talk to a surgeon just to get more information. You're not signing anything. You're not committing to anything. But it can be very eye-opening.
There we go.
Helina, what about you?
I would agree with Lisa on that one. Definitely, and do your research, but no matter how much doubts in your mind, take that leap. Take that leap of faith. And even if you don't feel like you're worthy or deserving of taking your life back, taking your health back, you so are. Don't let those negative thoughts stop you from this amazing change that's about to happen in your life.
I love that. Ashley, what about you?
I definitely agree with both of the other ladies. I would say that the surgery is for you. Like
Mhm.
it is for you. It doesn't matter whether like you're just barely qualifying or you're like no questions involved. Like I think the surgery is for you, um, and that you can do hard things. You're probably doing hard things right now, but you'll have a tool that lets you do all those hard things and see success, lasting success with doing all the things that you're already doing or you've already tried, that you can see success for all the effort you've put in, and you will put in, that it can work and it'll be something that can stick this time.
Mhm.
Absolutely. I love that. Well, thank you, ladies, for joining me. This was an awesome conversation. And I know I've told each of you at some point, but I love talking to my pre-op friends because it just kind of reminds me about my journey and the excitement. I get re-excited about bariatric surgery again. So thank you for spending some of your Saturday with me.
Yeah, thank you for having us.
Yeah, thanks for
Thank
the invite. This
you.
was really great.
I loved it.
Much fun. It's just like a conversation, right? Like it's all
Mhm.
and to everyone who is listening or maybe watching, thank you so much for liking, commenting, sharing our podcast. Just by doing all of those, you're not only supporting April, Jason, and I, you're supporting other bariatric patients, whether they are starting their process, thinking about starting, or have had their surgery already and need some extra support. Just by sharing and commenting with others, you're bringing the bariatric community together. So if you are listening, we encourage you to watch us on YouTube. We're all pretty cute and animated, so just adds extra spice to the conversation. And our YouTube is just BariNation. We're also on Spotify, Apple Radio or Apple Podcasts, like literally anywhere that you get your podcasts, we are there. So again, thank you all for listening. And just remember, at the end of the day, you've got this and we've got you. We'll see you next time. Bye.
Bye.